Hello everyone and welcome back. This is Dr. Ramya Bevoor, your very own family physician, and in today's video I'm going to talk to you all about something very important. One of the best miracles of God is life. He's the one who brings a newborn baby into this world, and to help them survive, and not only survive but to thrive and grow, He has given them a wonderful provision as well, which is freely and easily available to all without any discrimination. Yes, you guessed it right, it is the mother's breast milk. As the world observes Breastfeeding Week in the first week of August, in today's video, I want to talk to you all about the importance of breastfeeding. I'm going to answer some questions and bust some myths in the coming few minutes. The first question that's commonly asked is, why should I even breastfeed my baby? What are the advantages of breastfeeding? So breastfeeding has dual benefits both to the mother as well as to the baby. Firstly, talking about its benefits to the baby, breast milk has all the nutrients that a baby requires. Adequate amounts of protein, carbohydrates, fats and minerals. Also, breast milk has special fatty acids which help in the brain development of the baby, also helps in improving the visual acuity and improving a baby's IQ as well. Breastfeeding activates all the five senses of the baby, including touch, smell, sound, vision and speech. Breast milk is also very easily digested by the baby. It helps in developing a bond between the mother and the baby, hence resulting in a good psychosocial development for the infant. Also, it acts as a natural immunization for the baby and helps in preventing various infections. It also reduces the incidence of anemia in the baby. Talking about the benefits to the mother, it has various benefits to the mother as well. First of all, immediately after delivery, the uterus has to contract back in order for the bleeding to stop. So breastfeeding helps the uterus to go back to its normal size. It prevents and reduces the risk of postpartum hemorrhage, hence reducing a chance of anemia in the mother as well. Also in diabetic mothers, it reduces the need for insulin. It also acts as a natural contraception. Normally, mothers who are exclusively breastfeeding will not get pregnant, at least in the first few months. Also, it boosts the immune system of the mother. Sometimes it helps them to lose the weight that they have gained during pregnancy. Not only that, breastfeeding protects the woman against breast and ovarian cancer in the future. So these are all the amazing benefits of this amazing breast milk that God has created. So going to the second question that is most commonly asked, it is, when should I start breastfeeding my child? There's a very simple and straightforward answer to this, and that is immediately after birth and preferably within the first 1 hour of childbirth. However, many times it gets delayed because of various reasons and misconceptions about initiation of breastfeeding. There are various myths surrounding this as well. The first myth is that the first milk that is produced is poisonous for the baby and needs to be discarded. However, this is far away from the truth. This first milk that is produced is called as colostrum. It is a very small amount of milk that is produced. It is thicker than the usual breast milk and it is yellowish in color. This is very special because it has large amount of protein, almost 10% of it is protein, and less amount of fat and carbohydrate. It also has vitamin A which the baby requires. This should definitely be given for the baby because this is like a natural immunization. It is like the first shot of immunization that God Himself has created. Myth is that the mother is tired after childbirth and needs rest, so needs to be separated from the baby. Yes, the mother will be tired after childbirth, but she should not be separated from the baby just in order to rest. You can just place the baby in between her breast with the face down. The earlier we initiate the contact between the mother and the baby, a better bonding develops, a faster secretion of milk happens, the uterus contracts, hence reducing a chance of a postpartum hemorrhage. The baby also learns to latch faster, and the baby also gets a warmth from the baby which is required for it to prevent a hypothermia. This is also called as kangaroo mother care. So it's very important that we take the baby to the mother as soon as the baby is born and place the baby on the mother's chest. Third myth is that the initial milk is insufficient, so we need to give extra milk. This is not true. Since the colostrum is thicker, even a less quantity of the colostrum is sufficient for the initial needs of the baby. The fourth myth, and something that's very common, is that we should give something like honey or ghee, etc. to the baby before feeding breast milk. This is a complete no-no and should always be discouraged because it can cause more harm than good. Honey especially has spores of Clostridium botulinum, which might not harm adults, but it can cause toxicity in babies, which can be quite fatal as well. Hence, please do not give any extra milk or water or honey or ghee or whatever it is as per the tradition before feeding the mother's breast milk to the child. Okay, so going ahead, the next question that is commonly asked is, how long should I breastfeed? Exclusive breastfeeding is recommended for the first 6 months of life. When I say exclusive, it means nothing else should be given other than the breast milk, not even water. Some people may have this doubt that in summer, when it is very hot, the baby might get dehydrated and might need water. However, the breast milk is more than enough to provide the water requirements to the baby as well. You can breastfeed the baby a few extra times during the summer months. However, after 6 months, the baby starts moving more and starts growing, so it needs extra nutrition as well. So this is the time to add on complementary feeding. So breastfeeding along with the complementary foods have to be continued for 2 years and beyond. So what are some of the foods that you can start the baby on at 6 months? So the best thing to do would be to start the baby on your staple diet. Could be rice, ragi, wheat, millets, whatever it is that you make commonly at your home, you can give the same thing to the baby. Only thing is, make sure that it is well cooked and soft and smashed and in the form of a porridge. You can also add some water or milk and sugar, jaggery and ghee or oil in order to increase the fat content and the energy density of the food. You can start it as a thin porridge, and slowly as the baby gets used to it, you can make the consistency a little thicker because it will have more nutrition in it. You will also need to slowly start adding vegetables into this. You can also add greens like spinach, and make sure that you include fruits like banana, papaya, chico, etc. in the baby's diet as well. If you are a non-vegetarian, you can definitely start the baby on eggs, meat, fish, etc. But do remember, exclusive breastfeeding for 6 months and complementary breastfeeding up to 2 years or beyond. Alright, so going ahead, the next question that's commonly asked is, I need to rejoin for work. How do I breastfeed my child now? One thing that you need to understand is that all working mothers are entitled to 6 months of paid maternity leave. If it has not been given to you, please ask your employer. It is your right. Beyond that, or even during that, if you have to go for work, then there are some companies which do offer an option where you can take the baby along with you, leave it in the creche and feed the baby in between. If that is not possible, the other method that a working mother can very safely use is expressed breast milk. So you can express your breast milk and store it at room temperature for up to 4 to 6 hours and in the fridge for 24 hours. Only make sure that if you are feeding the baby milk from the fridge, then wait for it to come to room temperature and then feed the baby. You can feed the baby using a palade or a spoon. At the night time when you are at home, you can put the baby at your breast and breastfeed the child. So one of the other questions that is asked is, what is the best position for breastfeeding? The best position is what you are comfortable with. There are two main ways that mothers breastfeed. One is a lying down position and the other one is a sitting position. Whatever position you use, both are equally safe. Make sure that you are well supporting the baby when you are feeding. Many women feel that if you breastfeed in a lying down position, the milk may enter the ear and cause infections. This does not happen. It is a myth. You can breastfeed in both the position based on whatever you are comfortable with. Only thing that you need to make sure is that the baby's mouth is completely covering the nipple as well as the areola, which is the black part around the nipple. That is when you will not have that is when the baby would latch well at the breast and you will not have any pain or cracked nipples, etc. So another question that is commonly asked is that I'm right now suffering from fever, cold, etc. Should I stop feeding my child? So the answer to this is that breastfeeding can continue in most of the situations. You can check with your doctor if you have any specific chronic conditions or if you are on any specific medications as such. If you have common illnesses like common cold, fever, etc., please continue breastfeeding the child because the viruses will not spread through your breast milk, but it can spread through your contact with your baby. So to avoid that, you can use precautions like washing your hands, wearing a mask, etc. If you have any chronic illnesses like diabetes, hypertension or thyroid, if you are on thyroid medications, please don't stop breastfeeding the child. You can continue breastfeeding the child while taking these medications. Like I said, please check with your doctor before you stop breastfeeding on your own. So, these are some of the questions that are commonly asked regarding breastfeeding that I have tried to answer in this video. Do let me know if you like this video, and if you have any questions or doubts, please feel free to ask in the comment section. I will be more than happy to answer your queries. Thank you for watching. Have a good day. Bye-bye.